You know that feeling? That nagging, tingling, sometimes downright painful sensation of a pinched nerve? Yeah, it's super common and can totally throw a wrench in your day. Well, today we're going to dive into a pretty fascinating, minimally invasive technique that might just be a game changer for this exact problem.
All right, so here's how we're going to break it down. First, we'll talk about what a pinched nerve actually is. Then, we'll introduce this new solution, hydrodissection. We'll dig into the evidence, starting with carpal tunnel, and then see where else it's being used. We'll also figure out what's the best stuff to inject, and wrap up by looking at what this all means for the future.
Okay, first things first. Let's really get a grip on the problem we're dealing with here.
So, we throw around this term pinched nerve all the time, right? But what is actually going on in your body when that happens?
Well, the fancy medical term for it is entrapment neuropathy. And it's pretty much what it sounds like. A nerve gets physically squeezed or, well, entrapped by all this stuff around it, muscles, ligaments, you name it. And the poster child for this condition, the one everyone's heard of, is for sure carpal tunnel syndrome.
And we're not talking about some rare condition here. Carpal tunnel syndrome alone can affect up to 16% of the population. That is a huge number of people dealing with pain, numbness, and just not being able to use their hands properly.
So that brings us to this really promising new approach. It's a minimally invasive technique called nerve hydrodissection.
So how does this actually work? It's pretty clever, really. First, the doctor uses an ultrasound to get a perfect, crystal-clear picture of that trapped nerve. Then, watching the screen, they guide a tiny needle right to the spot and inject some fluid right around the nerve. I love this analogy. It's kind of like using a gentle stream of water to carefully peel apart 2 pages of a book that are stuck together. That fluid just mechanically, physically, frees the nerve from all the tissue that's been squishing it.
And what's really cool is that this thing works in 2 ways at once. You've got the mechanical effect, which we just talked about, the liquid literally pushing things apart and creating space. But then there's a pharmacological effect, meaning the liquid itself can have some therapeutic properties, maybe to reduce inflammation or help with healing.
Okay, that all sounds great in theory, but the proof is in the pudding. Does it actually work? Well, let's look at the science. We're going to focus on carpal tunnel, because that's where we have the most solid research.
So this table comes from a big meta-analysis, basically a study of studies. It's comparing the different things they can inject, the inject dates for carpal tunnel. And check this out. In the short term, that first month or so, 5% dextrose, or DW, was the winner for both function and symptoms. For longer-term symptom relief, platelet-rich plasma, or PRP, seems to pull ahead. And what about the old standbys, corticosteroids and saline? Well, you can see their effects kind of fizzle out over time.
And here's another really interesting piece of the puzzle. It's not just what they inject, it's also how much. This study looked at different volumes, and the results are pretty darn clear. 10 milliliters of that dextrose water gave the best symptom improvement at the 3-month mark. It just blew the normal saline out of the water. So volume definitely matters.
But listen, this isn't just a one-trick pony for wrists. The technique is showing some incredible promise for pinched nerves all over the body.
Okay, get this. There's this awesome case study of a baseball pitcher. He had a pinched nerve in his elbow. It's called ulnar neuropathy. And it was causing pain and that awful pins and needles feeling in his fingers. I mean, for a pitcher, that is absolutely career-threatening, right? And here is the punchline. After just one of these procedures, he was back on the mound. Just 4 days later, he pitched a full game at his usual level, completely pain-free. I mean, wow. That is an incredibly fast and effective turnaround. All right, if you thought that was impressive, check this out. This next case is about a woman who was suffering from a painful trapped nerve in her thigh. The condition is called meralgia paresthetica, and she had been dealing with this for 20 years. Can you even imagine?
So all the usual treatments had failed her. She then went through a series of these hydrodissection treatments. And the result? Not only did her pain get way better, but the tests they do to measure nerve signals, they actually showed her nerve was working better. It was healing. This is huge because it shows this might even work for people who've been suffering for a really, really long time.
Okay, so we've seen this procedure works with a few different substances, which naturally leads us to the big question, which one is the best? What's the best stuff to be injecting in there?
Well, based on all the evidence that's piling up, there is one clear frontrunner starting to emerge. And that is 5% dextrose in water. You'll often just see it called WD.
So why all the buzz about DW? Well, the list of benefits is pretty compelling. For starters, it seems to be way safer than corticosteroids. You don't have to worry about all those steroid side effects. It's also a whole lot cheaper than platelet-rich plasma. The research also shows it gives longer-lasting relief, people get their function back, and it can even mean patients need fewer oral pain meds. It really seems to hit that perfect sweet spot. It works, it's safe, and it's affordable.
All right, let's bring this all home and think about what this could mean for the future of how we treat these really painful, really debilitating conditions.
Yeah, this quote from a big review on the topic really just nails it. Hydrodissection, or HD, isn't just some small improvement. It has the potential to be a major leap forward, really boosting the overall success rate for treating these problems.
And this is so important because, let's be honest, the standard conservative treatments, they don't always cut it. For carpal tunnel, something like 2/3 of patients who just try rest and splinting still end up on the operating table. So we desperately need a better option that's less invasive than surgery.
Which leaves us with a really provocative final thought. I mean, dextrose, that's just a simple sugar. So could something as basic as sugar water, when it's precisely injected with a needle, actually replace surgery for a lot of people? It's a wild question, but all the research seems to be pointing in a very exciting direction.